Coming to Wake Forest University School of Medicine was a really easy decision for me. It just has a great caliber of education. I knew that I would be really strong in clinical training, and I loved that they had early patient exposure, and it just all really excited me. Once I was diagnosed with lupus as a teenager, I think that really propelled me to the field. Looking back, I have doctors that I still remember from when I was 14 years old who really just did small things that changed the way that I looked at maybe my illness or my future, or how things were gonna go, and just made me feel comfortable and my family feel comfortable and safe. And I think being able to be that person for families who can be there with them and say, like, I'm on your team and I'm gonna make sure that you're okay, you're comfortable, you're safe, and we'll get through this together, is something that just means so much to me, to be able to do that. One of the hardest parts of having an illness is just suffering and not understanding why. And I think that for some patients, even just being able to put a name to something is just a huge thing for them.
Whoever's lucky enough to be a patient of Sydney's in the future will be fortunate indeed. Not only does she have the fund of knowledge and the book smarts and the clinical reasoning skills, she's also an incredibly compassionate individual. And I have no doubt that being on the other side of the stethoscope, if you will, for Sydney has inspired her and motivated her to become the best possible doctor she could be.
I had a patient one time tell me, I had taken care of them all week, and when I was discharging them at the end of the week, they said, I don't want to cry, but have you been sick before? And I said, yes, sir, I have lupus. And he said, I could tell. You are somebody who has interacted with me in a way that I think only somebody who's experienced illness would be able to. And I just want you to know you're going to be a great doctor, because it meant a lot to me. To be able to use something that I didn't choose for good has been awesome.
And she is just a wonderful person. She's so caring and compassionate. She's patient. She is always there for her family and friends, involved in the community. She has such like a giving heart and spirit. She's also incredibly smart, but not in a I'm smarter than you way, like never. She is always there lifting each other up, making you think, making you work on yourself in a way that is uplifting to all. Like such a team player. Just by being Sydney just inspires everyone to be better.
One of my favorite things that I've done outside of classes here at Wake Forest is I've done a lot of work at the Ronald McDonald House. I came into medical school knowing that I wanted to do volunteering there. My parents have actually been serviced by the Ronald McDonald House. They've stayed there multiple times. Started volunteering there as a craft night organizer, so I'd go in and do crafts with the families once or twice a month. I started applying for grants. I received 4 or 5 that funded years of programming at Ronald McDonald House. I knew coming into med school I wanted to be in a field where you interacted with patients and families going through really challenging times. And I think I neglected to think about pre-surgery as like a really scary time for families. When I went on my surgical rotation, I saw how scared families were. And I really loved being that person who could quickly reassure them that I was gonna keep them safe, comfortable, and that I would be with them the whole time.
There are few challenges and few interactions that she has not had with the healthcare system over the last 4 years. And all of that experience that she has personally brings a level of insight and perspective that you can't teach. And so she is going to be able to empathize with her patients from just a different angle that most people won't be able to, and make them feel seen and heard as a person and valued. And so I would want her as my doctor if I was about to be put to sleep or in any other situation. So she's going to be a great doctor, yeah.
I have just learned so much from my classmates because we all come from different walks of lives and different areas of the country. And just getting their perspectives has been really important for me in opening my mind about things that I hadn't encountered in where I grew up. And again, just giving me different perspectives, which I think are really important for caring for patients who are going to come from all walks of life. But more than that, I feel like my classmates have just become some of the best friends that I've ever had in my life. And I know that no matter where we all end up, I'm going to have such an amazing network of people.
It's hard not to be amazed, really, at how much she has accomplished during medical school. And I think it's also important to note that she was elected for this award by her classmates. And these are people who know her very well, people who have spent 3.5 years with her.
The cool thing about anesthesia is like I interact a lot with the peds hemonc population, especially as peds anesthesia, because a lot of those kids get sedation for their procedures, like lumbar punctures, bone marrows, whatever. And there's even jobs where you can work like down at radiation oncology, just taking care of kids who are getting radiation treatments where you sedate them, and you really get to know the families because they're coming back like 15 times, and so you get to know what they like, and you get to know like what makes them comfortable and how to talk with them before and comfort their families. And I think that's like super cool, and something that I could really see myself doing is like working in that type of sedation suite population where I'm seeing a lot of these chronic kiddos who are just going through a lot, but I can get to know them and hopefully make their time a little easier. I want to thank the Medical Alumni Association for this honor, and I also just want to say a thank you to my supporters who have been with me on this medical school journey. My family has been amazing, and I couldn't have better parents and siblings. And I also want to thank my chosen family, my best friends that I've made here. Everyone has just made my time at Wake 4 years that were probably the best years of my life.